My name is Marcus Cope. I'm an orthopaedic surgeon. I replace joints of the lower limb, that's namely hip and knees, that have become arthritic. Today I'm going to talk to you about the risks that are related to joint replacement. So the majority of joint replacements occur with no problems, and people end up with a joint that hurts less than the previous arthritic joint that they had, and they can lead a more full life. Joint replacement isn't a life-saving operation, but it can be a life-changing operation if you have been struggling with your arthritic joint for a large amount of time. So what is a joint replacement? All a joint replacement is where the ends of the bones that come into contact with each other and normally covered in cartilage are replaced, either with metal, ceramic or plastic. This can allow the joint to move smoother and removes the arthritic pain that people previously were experiencing. In the UK, there's over 80,000 knee replacements done per year and about a similar number of hip replacements done a year. We collect all the data on a registry, which you will, if you have your operation done in England, will sign a form giving permission for the data to be collected. This allows us to assess how the joints have been functioning, how long they are in, and also gives data on individual surgeons. However, there are risks associated with joint replacement, and I'll go over those today. So the main risk with joint replacement is infection. Your skin acts as a natural barrier preventing bacteria from getting inside. Unfortunately, when we perform a knee replacement, we have to breach these defences. Bacteria can either enter at the time of surgery, or it can enter through seeding at a later date, such as bacterial transgression through hematogenous, basically that just means blood, spread onto the artificial joint. The artificial joint has no blood supply running through it as it's metal and plastic, and so is unable to defend itself against a bacterial infection. What tends to happen is that the bacteria can grow onto it. They produce a protective coat, a bit like going into a bunker to protect themselves. This can lead to long-term pain in the joint, eventual loosening, or it can lead to more aggressive infections where pus is discharged from around the joint. However, we take lots of precautions to reduce this risk as low as possible. We operate in special theatres with a special airflow system that reduces the risk of infection. We wear special protective clothing that looks a bit like a spacesuit. Patients that see us in this are often surprised what we're wearing. This is to protect you from infection and also protect ourselves from blood spatter. We also give antibiotics, and we try and get the wound to heal as quickly as possible. All these things reduce the risk of infection, but unfortunately it still can occur. Usually it should be in the order of less than 1 in 100 people suffers from an infection. Sometimes it can be just a superficial infection that can be treated with antibiotics. Sometimes it can be a deeper infection, which may involve sacrificing the joint replacement that you've had. The other risk that's involved is blood clots. Whenever anybody's operated on, the blood naturally gets a bit stickier. This is to obviously aid us from an evolutionary point of view of stopping us bleeding excessively. But in the case of surgery, sometimes it can cause blood clots to occur where we do not want them to occur, namely in the lower limbs, so lower down in the legs, or to the lungs, which is called a pulmonary embolus. This can be more serious and sometimes will require you to take longer term anticoagulants or drugs that thin your blood. However, thankfully this is excessively rare, as more and more patients are mobilising quicker due to the improvements in the surgical procedure. The other risk is that fractures can occur around the implant, either at time of surgery or at a later date following a fall. The other problem that can occur is that joints do have a lifespan. Quite often patients say to me, "Oh, this knee only lasts 10 years." Now we know that's not correct because joints have data collected on them and there are recorded evidence of them lasting 20 to 30 years. We know that the majority of patients in their 70s that have a knee replacement or hip replacement that joint replacement will outlive them. However, a small proportion will require further surgery. The younger the patient, we class anybody under 55 as a young joint replacement, will have a slightly increased risk of further surgery. This is because the demands on the joint are higher. Someone under 55 will usually be working age, will be more active on a day-to-day basis than someone in their mid-70s, which is the usual average age of joint replacement. If it does fail, then the joint can be replaced, but unfortunately the outcome sometimes is not as good as the joint being replaced the first time round. The other risk is risks to the overall health. This is why patients are screened before they come through to surgery and why they have what's called a pre-op to basically make sure that all the other conditions that they may have are optimised and they can be as fit as possible for surgery. Different things that can occur are sometimes people can have heart attacks because bleeding puts more stress on the heart, and this can initiate a heart attack if there is pre-existing problems with the heart. The other problem that can occur is sometimes patients can have strokes, but again, usually if they have pre-existing problems. If someone is otherwise fit and healthy, the overall insult from them from the surgery is very minimal and they usually recover with no problems at all. The reason why we have to go in depth now is that so you can make an informed decision on the fact of whether or not you wish to proceed to surgery. Obviously, this is balancing in your mind what the risks are from surgery, which your surgeon should go through, and also what the likely benefits are in the fact that you will be more mobile, your pain will be improved, and you'll generally, usually in most cases, be better following surgery than you were prior to surgery. I hope this general overview of the complications relating to surgery is useful. Please feel free to go to my website that's showing on the computer here, which is www.marcuscope.com. I'm an orthopaedic surgeon that works in the northwest of England and will be more than happy to see you to discuss anything that's raised in this video. Thank you for your time.